Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Thursday, February 17th. Welcome to you, and welcome to Ed Brubaker, our Living Branches President and CEO. Nice to see you again.
Good to see you, Alex. And it's a Thursday.
It's a Thursday, and we have good news to report from the COVID front. We are down to only one resident in personal care at Souderton and one resident in healthcare at Souderton testing positive. Other than that, we are COVID free. Of course, we also have managed to clear, if you will, our Norovirus outbreak in personal care and healthcare at Souderton, but it has theoretically or probably made its way to Dock Woods instead. So we're not out of the woods yet.
Yeah, I guess it's under the rule of there's always something to deal with when you're serving so many people, and I think that's part of the reality. So that would be clarifying no staff as well at the moment.
As of this moment in time.
Yeah.
Yeah.
And so when you think about those numbers, I mean, we obviously track them on a weekly basis to look at where things are going. And so when you look at those numbers and say where we were last fall, I mean, well, let's begin with the summer.
Yep.
At times we were below 1% positivity rate. Then September came, and part of the reason I don't remember that well is our daughter was supposed to have her wedding celebration and she got COVID. Even being careful as she is and vaccinated, et cetera. So that's the reality of our life, right? But that's when it was creeping up,
Yep.
Going late August into September, and then we kept watching it go from 5 or 6% to 7% in November, and then in January of this year, it just went crazy for Montgomery and Bucks counties, and was up at one point as high as 30%. But interestingly enough, going into this, I think we had a fair degree of confidence that it was going to drop pretty precipitously on the other side, because that's what they were experiencing other places with Omicron, and that's been our experience. We don't quite know now where this is going in the coming months. Are we going to have more surges, et cetera? Because it felt like before, every time we thought it was gone, then Delta came, then Delta left, and Omicron came.
Yep.
Fortunately, it doesn't feel like there's anything right now, but the precipitous decline and just really off the charts. So we are not down to September numbers yet, but I think we're between 7 and 8% this week. That's always a lagging indicator too, but for Montgomery and Bucks County. So that is so much better than what it does. And as we regularly say, our numbers reflect the community. The community is down and we're down, as you just said.
Yeah. It's nice to see that decline. And I think for us, at least in coronavirus response team, it's now made us even remotely considering, how does this end? What does this look like? Because clearly what we went through in January can't keep happening again. So, and how do we think we're going to be able to live with this in the long run?
Right. And I think it's something we'll be learning over time. Nobody really fully knows, and we still want to be careful and kind of roll back the restrictions, if you will, carefully, because we do serve a population that is in the more vulnerable category. So it's easy to read the reduction of mask and vaccine mandates, like in the newspaper about Philadelphia, for instance, and then say, well, when's our time? Well, the reality is we have a nursing center that has Department of Health regulations. We have personal care, which has Department of Human Service regulations. And so there are those kind of realities that we need to deal with. But it's good to be at this place. And the goal and the hope really is that this will continue to be at a lower level. But we don't know what the future is going to be. We've learned that the last 2 years, and we'll have to be ready for whatever it is. But we'll be addressing things at the moment. And certainly residential living is one of those areas that we have more flexibility because it's less regulated.
Yeah. And it's interesting to think over the next couple of years if this will start to follow sort of that pattern of flu, where summertime cases are really down, and then as the weather gets colder and everybody goes indoors, it starts creeping up again.
Yeah.
Kind of seems like it will, but of course it's too early to have
Yeah,
any
it's hard.
idea.
It's hard to know what the long term of this is going to be. And the interesting thing too is that there's a lot of things we call vaccines, but it feels like maybe there was some lack of clarity, perhaps, or kind of assumptions, perhaps, even because I was thinking about this last night again. I would suspect a lot of people that even would be persons who would not be wanting to get the vaccine wouldn't think twice about getting the polio vaccine, because I don't think anyone would want polio or smallpox or rheumatic fever, whatever those things may be. But with some of those vaccines, the efficacy was pretty much that if you got the vaccine, you would not get the illness.
Right.
So there was a kind of a direct cause and effect. I believe 100% that the vaccine for COVID is very important. But because of the fact that it's more like the flu shot where it's going to tamp it down or help you not get that strain, but there's still flu in that flu season. And so it's kind of this odd place we're in because it doesn't fully eradicate it, but it's really, really helpful. And there is no question. I mean, we've said this before. The people have passed away recently in living branches were the unvaccinated.
Yep.
So among the population we serve, no question in my mind that the vaccine is very important. But I think because of the fact that it's not this 100% thing, it's too easy to take pot shots, perhaps, and say, well, see.
It doesn't work.
Yeah. Whereas you wouldn't say the same thing about the polio vaccine, for instance. But I think that doesn't, for me, or hopefully for all of us, change the fact that it is still very, very important and has made such a difference. And I, for one, am thankful for it.
Yeah. Well, our questions from residents this week, dining is a popular question. So let's go back to that again, because people are asking, of course, when are we going to be able to have guests join us again in the dining rooms?
Yeah, and we had guests that could come in last year when the rates were lower. But then as we were anticipating the predicted Omicron surge for January, we felt that we really needed to close that off. And so we did. And we were essentially looking at it at 2 weeks at a time. And so last week we had coronavirus response team, and we decided to keep it closed again because we want to work out of this, if you will, slowly and intelligently, so we don't go too quickly and then have a problem. So it's always going to be trying to find that balance. But this will definitely be looked at again next week. And if the rates continue to drop as they have been the last few weeks, I would anticipate that there'd be, reopening at some point in the fairly near future for guests again. But we're watching the numbers. That's really what we're doing. And if they continue to continue in the direction they're going, I'm confident that we'll be able to work at the guest meal policy as well.
Yeah, people will be very excited to hear that. We also had a little bit of feedback this last week on our last video and what we were saying about empathy in society. So maybe we should talk just a bit about that.
Yeah, and there were some comments going back and forth from me and you, I think, around empathy and just the need for that in society. And I think in some of maybe our passion for talking about it and strong feelings about it, connected that a little too much to the vaccine when some of those comments were really more intended to be, society in general, that it feels like we're in this place where, we're missing an empathy gene for each other. And when you read things on Twitter and some other places, the attack mode that people go into so quickly is really unfortunate. And so here we are in COVID in the midst of that. And we want to redevelop that ability to be empathetic for people and empathetic for people who are coming at things differently from us too and have different opinions. And so, I think some of the comments could have been interpreted differently than what we had intended. And our intent was more to speak society in general and just the need for respect for each other, for empathy for each other, and and be respectful of people with different opinions. And that has been so important in the pandemic and will continue to be so important as we move forward.
Absolutely. So, another thing that happened for us in this past couple of weeks is the CDC had updated some of their guidance around who's vaccinated, who's boosted, what does that mean for nursing homes. And then this past week, the Pennsylvania Department of Health clarified some of that information based on what the CDC had. And I want us just to talk real briefly about this because this has impact on our residents, both residents who are in healthcare centers right now and residents who might need to be in healthcare centers right now. And as you know, essentially what the state has done now is it has divided persons into categories of up-to-date or not up-to-date. And so if you are an up-to-date person, you've either had COVID in the last 90 days, or you are vaccinated and boosted if you're eligible for a booster. And if you're not up-to-date, then you either haven't had COVID or you haven't been vaccinated or you're behind on your booster shot. So the big difference in this for us now is that if you are not up-to-date and you are in a skilled nursing center and you are off campus for 24 hours or you're just being admitted to that skilled nursing center, you have to quarantine for 10 days. And you also have to quarantine for 10 days if you are not up to date, if anyone in that nursing center tests positive. And that's a big change for people who maybe have had their first doses of the vaccine but haven't had their second or haven't been boosted.
Yeah, and that's an important thing to keep in mind too, because as people may be watching this video or people in the community or our residents, our staff, our positions that we need to take are also partly based on the regulatory bodies that tell us what we need to be looking at. And you're absolutely right. The old days it was fully vaccinated. Well, that meant you had your sequence of 2 shots or 1 shot, depending on which vaccine you got. And now with the booster, up to date is the qualifier as opposed to the term fully vaccinated. So maybe we should have invited Aaron Rodgers to explain all that. But, because words matter, right?
Yep.
And they're important to be clear as to what we mean. And so, yeah, that's the new terminology, up to date. And so if you are, and I think we may have talked about this a bit in the last video as well, but you need to be up to date in order to not have to quarantine. And that is a pretty big deal. The question in my mind is that going to stick for the long term, or depending where COVID goes in the coming months and coming year or two, because that has a big impact on our residents, on admissions to the nursing home, all those kinds of things. And so my sense is that's where we are now. That may need to evolve over time, but you're absolutely right. That's where it is now. And that does have some implications. So what it means really is that we want to encourage people to be fully up to date. And that means vaccinated or boosted or having had COVID in the last 90 days. Now, that would be the least desirable way to get to up to date, okay, in my opinion, but it is a classification that would be there. So it means we want to continue to encourage residents to be boosted. Because if you think about it too, if you're in personal care and are not boosted and you go to the hospital and need health care, you're going to need to be quarantining, as you noted. But if you're boosted, that eliminates that reality.
Yeah.
So it does get confusing, and we need to continue to get information out so people understand it. But at the end of the day, for our residents, the ideal would be that they're vaccinated and boosted, and that qualifies them as being fully up to date and eliminates what we just talked about.
Yeah. And what happens in personal care regulation also often follows what happens in healthcare regulation. And I think the thing that's maybe most concerning for me about the possible application of this in personal care is then if you're not up to date and you want to go home with your family overnight, if you're having a party or celebrating somebody's birthday and you want to stay overnight, you're going to have to quarantine for 10 days when you come back.
Right.
And that, I think, has more of an impact in personal care than it will in healthcare. So.
Yeah, that's right. And the interesting thing with that is, too, a lot of the things you're reading is, well, we're going to keep evaluating this to see where case counts go. I was reading that about the article in Philly and the, mask mandates and vaccination mandates to go into restaurants, those kind of things. So that, it would seem to me that that'll need to continue to be evaluated, because depending where this goes, if the case counts really continue to drop and it's not happening a whole lot, to have that level of restriction, from my perspective, in the long term is probably not ideal or helpful or needed. But that's what it is now. We need to follow those regulations, and so we need to also make our voices known and give feedback too as to how these things are impacting us. At the end of the day, it seems to me over the long term, the case counts in the local community are going to have the big impact on how some of these things play out.
Yeah. And I think that hopefully, at least, if summertime comes, this will resolve. But it does seem that DHS regulations and DOH regulations, they're definitely a lagging indicator.
Sure,
so
that's right.
It's going to take a while for them to change that guidance.
Yeah, and that makes sense too, because it's always easier to put a mandate in place. And you think about it, and then you might be late in getting it in place in the first place because you have to evaluate things. Well, the same thing applies when you're unwrapping things as well. And so it's just part of the reality, and we'll continue to work with that.
Yeah. And maybe we should just mention as a reminder on that, if you're not vaccinated or you're not up to date, we are doing vaccine clinics at Living Branches. You can check the website, the information's there. Or you can talk to your nurse or social worker, and they can help you sign up. So we want to make that available. And that's available for anybody. At this point, come one, come all.
Yep.
And maybe to close, maybe we should talk about something not COVID related, just for a moment or two.
Well, and actually, and before we get to that, though, there was some other reflection I was thinking about just because it was a phone call I had today. And that is this whole idea that we've been talking about at executive leadership team and otherwise too. We've been through this really difficult time, emotionally and physically and spiritually, and the last 2 years it's just really been difficult. And it was talking to a clinical social worker today, because I'm going to be bringing them in to do some work with our more senior level managers, at least with a few of them as a pilot, to see how it goes and how it's received. But the idea that he was reflecting on with me was, when you go through these kind of crises, and then it feels better, like it feels like we're getting into a better place. And then these other feelings of anger or resentment or other things come up when you say, wait a second, I should be feeling better, but where is this coming from? Those are natural occurrences. He described it in terms of his own situation at times in his life where he was coming out of a hard time, and these feelings that you think, I shouldn't be having them because it's getting better.
Right.
But it's that whole idea of how do we respond to crises and constant crises. And the idea is you got to be on, right? So you got to be on. You can't let your guard down. You need all the energy you can. But then if it's getting better, it's like you relax a little bit, and you don't have to be as wound, but then you start experiencing those other feelings that maybe you didn't allow in before. And so this getting out of this crisis will need some attention as well for our staff, for our residents, for our society, frankly, as we think about how do we make sense of this new reality, whatever that looks like.
That's really interesting, especially when you think about it in relationship to this type of event where just when you start to relax and think, okay, maybe I can get back to normal, it can come back again. Like it's not like a tornado or something that destroys your town and is going to be a one-time only event. It seems like it's always there in the back of your mind.
Yeah.
Yeah.
That's right.
We're definitely going to have to spend some time thinking about that.
Right. Yeah, the emotional element is sometimes forgotten in some of these kind of things.
Yeah, definitely. So, well, now should we talk about
non-COVID
related things? We have some construction projects that are going to be starting, hopefully very soon. I can't imagine how complicated it must be to try to work on construction things. I mean, I'm working on it a little bit, but to try to work on construction things in this market for getting resources and getting builders and suppliers and everything, it must just be terrible. But
Yeah, it's a little challenging, but we have a lot of good people working at it. And but yeah, that alone can be a full-time job, and then COVID is an overlay, and so it's been interesting in that regard. But yeah, we've been planning this for a long time, and certainly COVID slowed things a lot, particularly at the front end. But over the last year or so, we've been trying to move these projects forward. And essentially what it is healthcare at Dock Woods will be expanding the building because we need more square footage to have more private rooms.
Yep.
So we'll end up, I think it's around 45 private rooms in total out of the 72 nursing beds. And then at Souderton, it's actually a healthcare project. Again, an expansion to the building to create a memory care unit, 18-bed memory care unit, create more private rooms. Again, I think it's 43, and then modified private, another 6, so total 49. And then also a new park view, if you will. We haven't determined if we'll continue to call it that or not, but a new personal care memory care unit, which will again be larger in size, but also have all private rooms. So yeah, these projects, Souderton is a bit later than Dock Woods. We anticipate late spring, early summer. Haven't assigned an exact date yet, but late spring, early summer for Dock Woods, and late summer, early fall for Souderton. So we're at different stages in approval processes, even with townships, financing, board approvals, all those kinds of things. But it's going to be very exciting. It's going to be a lot of work. And it's kind of, they reference that sometimes eustress, meaning that it's stress, but it's positive stress because you know that it's going to be a good outcome at the end. So it will be a very good outcome at the end. We won't have all private rooms, but certainly the vast majority will be private, and that will be a very good thing. So that's coming this year. Todd Detweiler was recently moved into a new role. He's not quite in it yet because his previous role needed to be backfilled, but Todd will be our director of construction and really being the construction liaison for Living Branches for these projects. So yeah, we're very excited, and this is really just a preview of future communications that will be coming out to really help people understand what these are all about and what they can expect.
Yeah, it'll be nice to talk about this, and I think especially for residents, obviously, in healthcare and in Parkview. It's going to be a big change, and so I'm very excited about it. So
exactly.
People can expect more coming this year, certainly about construction. And then we can all start complaining about there's no place to park and everything is a mess.
That's right.
But
there's always something to complain about, right? I mean,
exactly.
That's just part of being human.
Exactly right. So, well, we'll look forward to those complaints. So thank you. Thank you to our audience. Again, if you have questions, please feel free to email me at coronavirusquestions@livingbranches.org, and we will see you in a later video. Thank you.